It's my pleasure to rise to speak to Bill C-442, an act respecting a national Lyme disease strategy, which has been tabled by my colleague from Saanich Gulf Islands and also seconded by my colleague from Vancouver East. I think it's worthwhile noting that this House has looked at the question of Lyme disease in incremental steps since at least 2008. At that time, Judy Wasilisa-Lease, who's a former member of Parliament from Winnipeg North, called for a national strategy as long ago again as 2008. And by 2009, she was submitting order paper questions in order to find out more from the government about what it was doing, or maybe perhaps better put, not doing. I also, as the successor to Jack Layton in Toronto-Danforth, it was of some interest to have discovered in correspondence that's been provided to me by a constituent that in 2008, January 17, 2008, Mr. Layton had written to the Honourable Minister of Health at the time in this government, outlining the life circumstances of David Leggett, one of my constituents who I rely on heavily in terms of his counsel on this issue. And to cut a long story short, Mr. Speaker, Mr. Layton asked the minister, indicated to the minister, that he had issued an information request under the Access to Information Act, requesting results on the proficiency tests of a federal laboratory with respect to the ability to identify Lyme in blood, or Lyme indicators. And the whole point was that the ability to do so is key to early detection and therefore to effective treatment. And there's this wonderful line in the letter, quote, "The request for information was denied on the basis of national security. Neither Mr. Leggett nor I can understand the basis for this response." End of quotation. So, although I'm not here to explain or to talk further about why such a bizarre response to an information request on Lyme disease would have been received, it is rather indicative of the climate that patients, advocates, and supporters have been facing for a good number of years. There seems to be this bunker mentality in various quarters, and maybe at this time, as far back as 2008, that was shared by this government. I realize that things are moving ahead, and Public Health Canada is more and more to be counted on as an ally in this struggle, and I do hope that that will lead to all members of this House supporting the bill from my colleague from Saanich Gulf Islands. I'd like to indicate that time is marching. According to the Center for Disease Control and Prevention in the United States, recently they've upped their estimate using a whole set of methods to approximately 300,000 Americans a year being diagnosed with Lyme disease. This is a 2013 analysis, and from that, apart from the high incidence, they conclude that the CDC and other researchers must continue to identify novel methods to kill ticks and prevent illness in people. And they also say, quote, we need, quoting Kyle Peterson of the CDC, quote, we need to move to a broader approach to tick reduction involving entire communities to combat this public health problem, end of quotation. Now, this is all well and good. It's very important to note the preventative angle, but it's also the case through my interactions with constituents, Mr. Speaker, that the whole question of diagnosis, once people are unlucky enough to have been infected, early diagnosis that leads to them potentially, if it's so early, actually being able to prevent any effects, but within a very short period of time that will be impossible, and therefore to receive effective treatment, that has to be as much at the top of our agenda as the broader prevention. It is also the case from recent information research that it's very clear that the relevant ticks are moving north, and that at some point in the next number of years, the large majority of Canadians will live in high incidence zones for that tick. So as I said, Mr. Speaker, time is marching. And what I'd like to do is point out that my colleague from Saanich Gulf Islands has devised something that is very very much about process, but process that will achieve something. The central pillar of the bill is the convening of a conference with all stakeholders within 6 months of the bill receiving royal assent to come up with a series of strategic outcomes, including, for example, establishing guidelines for prevention, diagnostics, and treatment. But what I like in particular, and what I know people in the Lyme disease advocacy community, the anti-Lyme disease advocacy community, if you like, what I most like about the strategy is how it makes sure to include the representatives of patient groups along with experts in the medical community, other experts in the medical community, because from experience grows expertise. And I can attest to that in my many conversations with David Leggett, that from experience, he has insights that almost no member of the medical profession could hope to bring to the table. I'd like to share the stories of two of my constituents by way of bringing that home. Allison says, quote, "I am one of your constituents living in the Danforth area who's been battling Lyme for the past 7.5 years. It took 5 years to receive a diagnosis, and now over 2 years of treatment to become more functionally stable. In 2011, I had to make the decision to go into massive medical debt in order to receive treatment. My Lyme literate doctor is located in New York. I lost the ability to work 4 years ago, and at this point I'm quite scared about my future. I'm only 38. I've watched my 30s just rush by. I know that if I had received an earlier diagnosis, I wouldn't have had to experience such difficulty recovering. I really don't want this to happen to any other Canadian, Lyme or no Lyme. All of us deserve medical care in our own country, and we deserve proper diagnostic tests and treatment. The current treatment guidelines for Lyme disease in Canada, set by the College of Physicians, is an absolute joke. 30 days of antibiotic treatment is antibiotic therapy is woefully inadequate, especially if a patient has been exposed to the Lyme bacteria for years. Personally, I didn't experience any noticeable long-lasting symptom improvement until 13 months into antibiotic treatment. I recently calculated how much money I had to spend on medical care in the last 7 years, and the total came to approximately $42,000. I want all MPs to know how incredibly expensive it is for Canadian Lyme patients to receive treatment. It never ceases to surprise me that I pay into a universal medical system through taxes that I have no access to. How crazy is that? And Donna also writes, I am a Toronto-Danforth resident who knows only too well of the devastating, physically, emotionally, and financially devastating impacts that Lyme disease has on a person. I am also proof, she says, that there's a need for proper diagnosis and that extended treatment can be effective. I lost 5+ years of my life and approximately $250,000 to the disease. I am mostly well again, and I have been very fortunate to have completed a successful return to work. With respect to my conservative estimate of the costs, I don't want to mislead you. I was treated in the U.S., but those costs were actually only a small part of the actual costs. I would end now, Mr. Speaker, by drawing again on my constituent David Leggett. His insights I always welcome. And he does say when it comes to a strategy, something the NDP always emphasizes within the framework of collaborative federalism. In a recent note to me, he said, quote, something to stress is the importance of working in lockstep with provincial government health ministries. To be truly effective, a national framework based on objective discovery, research, effective testing tools, training for doctors, and effective treatment regimens and timelines has to be set up and maintained. Also, he says, the fact that many Lymies, as he and others call themselves, have had to rely on U.S. laboratories and doctors for proper diagnosis and treatment. Without this support from beyond our borders and mostly paid out of our own pocket, echoing the other two constituents that I just quoted from, the problem here would be borderline catastrophic, end of quotation. So, Mr. Speaker, I think the tabling of this bill is timely. It's needed. I do congratulate and thank my colleague from Sandwich Gulf Islands for doing so. I fully intend to support it, and I hope that the strategy that does emerge from this, because I do have great hope that colleagues from across the way will also support it, will in fact make a big difference in what is likely to be a growing health issue for Canada in the years ahead. Thank you, Mr. Speaker.